This is a front view of a right ankle demonstrating some of the deep ligaments and muscles that stabilize the ankle. Most ankle sprains involve partial tearing of the ligament on the front and outside of the ankle joint, known as the anterior talofibular ligament. More severe sprains may also involve the ligaments on the inside or even above the ankle joint. With time, these ligaments will usually heal, although they may be partially lengthened. It is therefore important to engage in an exercise program to maintain strength of the muscles that help to stabilize the ankle and to maintain flexibility in the surrounding muscle groups. Gentle plantar flexion exercises should be begun early and be performed like this, using the rubber band holding in your hand and wrapped around the forefoot, gently push down away from you and allow it to relax. This should be done for 20 reps and be performed for 2 sets. The opposite motion is performed to strengthen the muscles that pull the foot towards you. This is done with the rubber band tied to a table leg or a doorknob and then wrapped around the forefoot. Gently pull the forefoot up towards you and relax. This should be repeated 20 times and be performed for 2 sets daily. Eversion exercises are performed with the rubber band stabilized at a point crossing the other leg. With the band wrapped around the forefoot, it is gently pulled away from the body and allowed to relax. This is then performed repetitively for 20 reps and again performed for 2 sets daily. Inversion exercises are performed with the rubber band attached at a point away from the other leg, wrapped around the forefoot is then pulled towards the body and allowed to relax. This is also repeated for 20 reps and should be performed for 2 sets daily. It is important for the eversion and inversion exercises to be performed with the knee facing the ceiling, as to avoid rolling the hips to accomplish the exercise, as opposed to using the ankle muscles, which is your primary goal. The average person can pull their forefoot off the ground about 15 degrees with respect to the horizontal while the knees are straightened. Anything less than this is considered pathologic. The appropriate way to stretch the calves is as follows. It involves 2 different stretches. The first one will be stretching the gastrocnemius, which is the muscle higher up in the calves. It involves placing the foot behind, which is to stretch, and the other one forward, while keeping the trunk and the thighs rigid, leaning slowly into the wall like a push-up. While keeping the knee straight and keeping the heel on the ground, this will effectively stretch the upper part of the calf, known as the gastrocnemius, and this should be held for 30 seconds. The second stretch is similar, but will help to stretch the lower part of the calves, known as the soleus. While doing the same maneuver, leaning against the wall, one leans in, similarly keeping the body and trunk rigid while doing this push-up maneuver, and then slowly bend the knee, and you will feel the muscle stretching farther down towards the ankle. This should also be held for about 30 seconds daily. For both these stretches, it may be difficult to perform with the foot farther from the wall at first, and so usually one begins closer up, and as flexibility improves, may continue to do these stretches farther and farther away from the wall. When the early pain and inflammation begins to subside, typically around 2 to 4 weeks after the sprain, depending upon the severity, one may begin doing heel raises and toe raises. Toe raises are done standing flat on your feet and then slowly raising up onto the balls of your feet and then lowering back again. This should be repeated 20 times and be performed for 2 sets daily. Heel raises are performed in an opposite manner. While standing flat on your feet, raise the forefoot off the ground and then slowly lower again. Repeat these for 20 reps, and these should be performed for 2 sets daily. Once the inflammation has improved and motion and strength have improved, the last step is to work on balance control. This is accomplished by doing single leg stances, such as this. Standing on the affected ankle for a period of approximately 5 seconds and allowing it to rest or as long as one can tolerate. This should be repeated for up to 2 minutes. As one gets better with balance, this should improve to 20 seconds or more. As balance continues to improve, one may then try to do it on a pillow. This adds an extra level of challenge and requires extra coordination of the muscles surrounding the ankle. Continue to do single leg stances, again, over a period of 2 minutes, allowing to rest depending on your ability to hold this balanced phase.